Welcome to the Balanced Ambition podcast. I'm your host, Matt Southam. Here, we delve into candid conversations with entrepreneurs, exploring both their business journey and their secrets to maintaining mental well-being. As we navigate the balance of ambition and inner peace, I hope you find insights, inspiration, and invaluable takeaways in every episode. Thank you for joining us. Fahad, welcome to the show today. I want to start by asking you to tell me a bit about you. Give me some context to your life. Give me a bit of background.
Sure. Firstly, thanks, Matt, for having me on board.
Pleasure.
Absolute pleasure being here. So just to start off a little bit about myself, I've obviously grown up and trained in the UK from a medical background. Both my parents were doctors. My father was an orthopaedic surgeon. My mother was a gynecologist. And the interest of mine to get into medicine, to get into medical school and pursue the sort of career I've chosen really stems from that. And throughout my sort of growing years, I've developed and honed in an interest in orthopedics, and that's where my specialty lies. So I'm currently a consultant orthopedic surgeon specializing in sports arthroscopic, which is keyhole surgery, and also arthroplasty, which is joint replacement surgery. And from then, over the last sort of few years, my career path has taken a little bit more of an interesting turn as I've started delving a little bit more into regenerative therapies and trying to provide options of care for patients from a non-surgical, non-invasive perspective and more from a holistic care. So that sort of started me on my entrepreneurial journey, if you like, where I'm the CEO and founder of Regenesiss, which is basically a company providing services for patients for regenerative therapies, also looking at patients from a holistic care perspective. So we sort of offer them a lot of different options apart from surgical interventions, and we obviously follow them up, and we sort of established and set up and currently opening up a flagship clinic in Manchester, with a few more satellite clinics around the country. And we are sort of on the brink of a global expansion as well to Europe, Middle East, and Africa. So in a nutshell, I said that's probably, my sort of background and my interest in regenerative therapies.
Yeah, I mean, taking back to some of the surgery you do, I mean, obviously these are, solving the problem as such, but they don't always look at the reason that that's come about, I guess. So you're taking a bit more of a wider view of not just fixing it. It's like, what's the cause of this and helping patients through that, I guess?
Absolutely right. I mean, throughout my sort of training in my early sort of career as a consultant, you always come across patients where you're trying to solve the problem they're in at the moment. And many a time we've only got one or two solutions when they come to see us, because sometimes they're too far down the line on a disease pathway or with a problem such as an injury or osteoarthritis in their joints. So they'll have very limited choices. So my take on that was, let's just take a step back and have a look and see when and how we can actually provide better services for patients before they reach that stage. If we can delay that stage, if we can give them good quality of life, better improvement earlier, so they're not struggling through a large, area of time before they actually reach that end stage where they need a solution. And the other thing that was very interesting for me was throughout my sort of training, you come across and you meet a lot of different people who are offering various different facets of care, whether it be non-surgical medical therapy, such as pharmaceuticals, or physical therapy, or your surgical therapies. But I didn't really come across anywhere where you could put all these facets under one roof and tailor and make a patient-specific program, really, that you can hone in and manage the patient from a holistic perspective to manage all the problems they're having, to try and stop and delay any deterioration of the problems they're having. And we've come across a lot of patients, whether they be sort of weekend warriors, playing a lot of sport over the weekend, injuring themselves, semi-professional sports people, and also slightly older generation where they've got, osteoarthritis and joint problems. So we've got sort of patient-specific treatment plans, which use all the various different facets to sort of hone in and manage the patient as a whole, rather than just concentrate on a knee problem, for example, or a shoulder problem, for example. And we've seen very good results, and we've obviously seen a lot of improvement. And we hope that this sort of sphere of regenerative therapies is here to stay and will grow. And we obviously are at the forefront of that. And more recently as well, our clinic has been awarded as one of the top 5 regenerative and cellular therapy clinics in the UK, which obviously, it's really good honor for us to be involved in that sort of sphere, if you like.
Yeah, I mean, I've certainly seen it where, if I've been to a doctor or medical professional, it gets something to cure it, but actually it doesn't necessarily help with why I got there, which is, I guess, what we were talking about before. You mentioned sort of weekend warriors and things like that, because traditionally, if you said sports injury, the only people who really got treatment were absolute professionals and it affected their day-to-day life. But actually, more and more people are injuring themselves and then deciding to go down the route of actually getting that fixed because they were enjoying whatever they were doing at the weekend. Are you seeing that more and more?
We are actually, and I'm smiling a little bit because I myself have got a knee injury from a volleyball game I played last weekend, so it sort of drives home the message, if you like. I think in the current sort of environment we're in and the people we're seeing, everyone's expectations are different, and a lot of people, want to be able to go away on the weekend, play sport, and they obviously get involved with league teams and sports with colleagues and friends, and they want to play at a reasonably competitive level. And sometimes when they do have an injury, it's a major setback because then they sort of write off the summer to say, well, I cannot go back, I cannot compete now, I'm going to rest it out. And it affects that. And also we get a few people who just want to go out with the kids, kick a ball in the field, enjoy the afternoon and evening. And if they have injuries, again, that prevents them from, going about doing what they like and what they love doing. So from that perspective, we've got sort of treatments and plans that actually can get people back to sport, back to their usual lifestyle quicker. So these therapies and treatments are not just now reserved for the semi-professional, the elite professional, where you see, you have a shot of an injection and you're back on the field within a couple of weeks. But these are actually now available and readily sort of used by most of the population, the public. And from that perspective, if you have a service that can offer that to, wider majority of the people to get them back to their sport, get them back to their, usual lifestyle, get them back to enjoy what they want to do, you're on a winner really with that.
Yeah, I mean, lots of us use sport and exercise as sort of means to actually improve our mental health as much as our physical health. I know certainly myself, when I was younger, I always sort of thought I was going to the gym because I wanted big muscles and things like that. And I actually realised now I need to go to the gym actually to release some of that sort of energy and stress and frustration. And actually an injury would affect me mentally as much as it would probably, physically, and it would be something I'd be looking to do.
Absolutely. I think, yeah, absolutely right. And I think we see a lot of people like that, especially if they're used to a certain, lifestyle with regards to doing sport and going to the gym regularly, and suddenly there was a halt on that. So it's not just the physical well-being that's affected, it's obviously, the mental well-being is affected. It keeps them down. They can't get back to doing what they want to do. It affects their work, affects their family life. And hence, again, where it comes in the holistic sort of care and approach, because we've got performance psychologists in our clinic who can actually work through with people to try and get them a little bit more positive, give them a little bit more timescales, timelines, and that works hand in hand with any sort of, medical or injection therapy we're sort of offering them. So that's why I always say you cannot just treat a injury or a problem on its own. You really have to sort of, take a step back, look at the whole situation. Everyone's lifestyle is different. Everyone's personal circumstances are different. Their expectations are different. So you should be able to sort of meet those expectations and have in your sort of service array, if you like, treatments available to sort of address all of those things.
Yeah. And actually we see it. I mean, certainly I'm in my 40s now, and I sort of realized actually the chance of me injuring myself playing sport is probably much, much lower. But I'm much more likely to injure myself sneezing or getting out of bed, a bit quick. And that's, I guess, because actually lots of us live quite a sedentary lifestyle where, we're sitting at desks, we're not being active enough. And do you feel that that's the case? Our bodies probably aren't as prepared to then just go out at the weekend and have a really hard game, because actually we haven't been that active during the week, whereas if you go back 50 or 100 years ago or 100, actually we were much more active. What can we do to prevent that?
Yeah, absolutely right. I think that sort of your inherent problem is because as you rightly said, people during the week are pretty sedentary. They don't really do much activity. But then at the weekend, you get a call from one of your mates to say, let's go. We've got a sort of football league game. Are you in? And you say, yeah, sure, that sounds interesting. You go there, your body's not used to it. You don't do a proper stretch. And then, that's the sort of recipe to, get your injuries. And I think from that perspective, what we always say is you need to have a sort of baseline therapy or program in place where at least 3 times a week you are doing some sort of exercise and activity. Also, from a medical perspective, it helps. And obviously from your body perspective, especially if you want to go back and do a little bit more vigorous sport in the weekend, then your body, your muscles, everything is sort of in tune and in line and ready, if you like, to take that next step. But if you go from 0 to 100, you see where the problem lies. So hence, most of our programs also sort of advise people to sort of have a baseline activity level where they're sort of doing minimal baseline activity, whether it be cardio or whether it be muscle strengthening, to basically get their bodies in shape and prepared for any extra sport. But even if they're not doing sport, it's always good to keep that exercise levels going. Because again, studies have shown that, they do improve not just your physical, but also your mental well-being. And obviously, that's an important aspect. But my advice would be is to keep regularly in your exercise, keep things, ticking along. Don't just, jump from 0 to 100, but, have a little bit of fuel, if you like, before you sort of reach that stage.
Yeah, I mean, I certainly see it, I think myself and my friendship group, I think mentally we all sort of still feel we're 20 again. But if we play a game of football on a Saturday, actually we're still aching on the Tuesday or Wednesday afterwards, rather than back in the 20s, actually play again Sunday, no problem at all. And, that's just where our bodies are, getting older, I guess. It's like anything, parts wear out, whether it's on a car or whether it's on your body, and actually maintenance, I guess, is quite a good way. And we are seeing sort of slightly more, I say, sports stuff come onto the market, whether it's massage guns and things like that, and lots of people are sort of taking, I guess, recovery, but equally preparation a lot more seriously now. And it's good to know actually that you then offer that service for when people do get injured. Because I guess injuries are just almost part of playing sport. You're never going to completely prevent it.
Absolutely. I think you've almost got to sort of expect it, and you take your precautions. And we always say before you start the game, you sort of make sure you stretch well, because that's an important element. When you finish a game, make sure you wind down by stretching down again. Those kind of things obviously help and prevent injuries, but you cannot completely sort of nullify them. And obviously, the more you play, the more active you are, the chances are at some point you will have an injury. And at that stage, it's not to say that, oh, I've got an injury now, I'm going to switch off, I'm going to stop doing everything. What we're sort of saying is you can get back. And obviously, with some of the treatments and therapies that are available currently, which are very non-invasive, we can do them over the clinic. You can actually get back to your lifestyle, back to your sport a lot quicker. And that's the sort of message really for most people. It's also the expectation. I mean, we see a lot of people, slightly elderly, who previously were not doing a lot of activity, not doing a lot of sport, but now the expectation is they want to get back to play doubles tennis, they want to play golf regularly twice a week. All that does take a lot of strain and stress on the joints, and because as we grow older, the joints deteriorate slowly. And if you're doing a lot more activity, you tend to sort of feel the pain, the stiffness a lot more. But again, for those people, we've got sort of maintenance programs that, can sort of say, you can continue doing what you're doing. And we just need to assess your level, get you at a level where you're comfortable, and then you continue on with your activities. Because I have a feeling that most people who are reaching a stage who've been reasonably active don't want to just switch off. They want to continue at some level of activity, because like you earlier sort of pointed, it has to do more with the mental well-being as well. So they want to stay active, they want to be, out and about, they want to be doing things, not just sitting, watching telly sort of, through the week. So for those kind of people, it's always good to know that there is options available. And, even if you've got the joint pain, it's not the end of the world. You can get back, onto both. You can get back onto your tennis courts and you can continue enjoying your lifestyle.
Yeah, certainly. So tell me a bit about your more recent journey. You were saying about setting up the clinics. Obviously, you've always been involved in this, but you've become an entrepreneur. So what have you learned from that, through that journey?
Sure, it's an interesting question. Well, first it has been a difficult journey. because as you can imagine, normally, people say you need to have at least 6 months, 12 months worth of kitchen expenses if you want to get into business and completely switch off. But unfortunately, I wasn't in that scenario. I wasn't in that category. So obviously was doing a full-time job and at the same time setting up the clinic. And my main drive for setting up the clinic was to be able to provide a comprehensive patient-centered care approach and service. And that was my main sort of driver. And it was a difficult journey because firstly, as you're working full-time, you're very time constrained. So what you can actually put in from regards to the time and effort into the business is a little bit less than what you would otherwise. So it has been slow, but because I had the sort of end goal always in sight, and that's what I would always advise to people as well. If you've got an idea, if you've got a good idea, you believe in it, you've got to always look at the end goal. Where do you see this in 5 years? Where do you see this in 10 years? And that should be your driver, really, to say, right, okay, there will be times where things will be slow. There will be times where things will pick up. And you'll always face obstacles. You'll always face failures. But as long as your end goal is in sight, you will get there. And that's sort of my journey, if you like. And from our perspective, again, going a few years back, we had a bit of a setback with COVID. Again, from a personal perspective, that was difficult, but obviously I'm not alone, because I think a lot of, businesses, not just in the UK, but globally, suffered and struggled with that. So that was a bit of a major setback for over 2 years, which pretty much stalled things, right in the tracks. And then you almost have to restart from square one again. There was difficult questions I had to ask myself at that time is, do I have enough fuel and gas to push this along again, one more time from a startup?
Yeah.
And, you always have to sort of look at the pros and cons. And I said, well, the end goal is still in sight. You've done a bit of work. This is a setback, so you've got to restart again. And I'm really glad that I did, because it's sort of over the last 2 years, it's picked up again and reached a stage now where we are. And it gives me the satisfaction to know that, right, we didn't give up, we kept going. And again, that's a key element as well. What I would sort of advise people is, keep going. You will have difficult times, you will have setbacks. As long as you have the end goal in sight, you believe in your idea, you believe in your vision, then, you will get there. And the other thing as well is having sort of a lot of people on your side helps, because obviously having your family support, having a couple of people you can bounce, discuss ideas with, who've got your back, got your front. It's always good to have that, because they help propel and move things along. At the same time, you do get a lot of people, will put in a lot of negative causality, you're putting too much time and effort, it's not going to work, give up now, cut your losses. So I think it's a fine balance. And I always say that you've got to probably pick 2 or 3 people that you're really close to, that got your best interest at heart, use them to sort of bounce ideas, discuss with them, and they will always push you along. And sometimes the other bits you just got to block out. You got to say, right, thanks for that, but, I'm going to keep going. It's just one of those things. I mean, there's no right or wrong with this. So it has been a difficult journey, but overall, I think it's been a very, very good learning experience, if I was to add that. A lot of people say you learn from your successes, but I think you learn a lot from your failures. You learn a lot how not to do things. You learn a lot how to tweak things. You learn a lot how to, circumvent things. You learn a lot of who to ask for advice, who not to ask for advice. And every step of the way you build, you learn, and that sort of reaches or helps you reach the end result. And I think at the time, you probably don't think, oh, it's a failure, it's a setback, you're down, you're low. You think, oh God, I got to pick yourself again, but you don't think you're learning. But I think all of those events actually inherently, subconsciously somewhere building up a skill set that you will eventually, need as you go along. And I'm glad, I mean, a lot of people probably wouldn't say glad of failures, but I said, I'm glad we've had a few setbacks. It's not always been, happy go days. So, because it's just taught me a lot of things. It's taught me more about myself. It's taught me about my determination. And I think that's a key element as well, because you need to sort of fall back on yourself. You need to know whether you've got the reserve to sort of push this, as far as it'll go. But yeah, overall, it's been a difficult journey, but I think we're finally over the hill now. So I'm glad to say that, we've passed a difficult phase. Things are sort of getting set up now. Things are getting a little bit more concrete. We've got a good team now. We've got a good setup. And we're basically now obviously looking to expand further locally and globally. So from that perspective, we were positive of the future. We're positive that we are actually providing and making a big difference to patient care. And that's always been my driver. And with that perspective, we're looking forward to the future.
Yeah, I love that you're learning from failures, because I think that's absolutely essential. I think so many people go into business thinking it's just success after success after success, and quite often they're the messages we see on social media and things like that. But actually, taking the path is bumpy as you go through, and yes, you want to celebrate success. I don't disagree with that, but equally you've got to understand that sometimes those setbacks actually teach you a really important lesson. You've actually just found a way that it doesn't work, and it means you're able to refine a process and get better. I quite often put it down, when you get complaints or negative reviews or things like that, a lot of people would think that's terrible, but actually it enables you to get your business better. It enables you to take that and learn from it and say, okay, how can we improve? And that is how, if you keep going in the long run, actually you're going to end up with a product or a service that really serves your target audience really, really well and answers all of their problems.
Yeah, absolutely agree with that. You're spot on there, really, because it is, a lot of people get down about negative ideas, which, you should be critical about it, but you should obviously try and use them to sort of, better your service and better what you're doing. Absolutely.
Yeah, I think that there's always going to be, fear and negative thoughts and things like that along the journey. What the trick is that they're not the driver. You need to, have them there, but actually you're in control. You've got your vision, your mission, whatever it is you're trying to achieve, and actually just take a small step forward every single day is a key thing that I think entrepreneurs, we've got to embrace.
Yeah, absolutely.
So what do you do for yourself? I mean, you're certainly, if you're in surgery and that, you're focused, your mind is on that. How do you then switch off at other times? What do you do in your own time?
Yeah, a lot of people have asked me that, and I think a lot of people ask doctors that, because obviously it's a very high intensity job, and we're at the forefront of quite a lot of things, and it's stressful at times. So from, I think, my perspective, you do need to switch off, because sometimes it's a lot to take in through a busy day. It's a lot to take in through a stressful day, especially the surgeries. And if you go home and if you're not switched off, it tends to linger on. It tends to carry on through your evening, through your night. And then that has an impact on you and your family. So the way I sort of look at it is, I just go home and forget about the day. And I'm a very sort of family person. I like spending a lot of time with my family, just relaxing, unwinding, with the kids. And that really helps me mentally relax, even though you don't think you're actively doing it, but it actually automatically does. And in a way, not discussing about work too much, not bringing, your problems home and trying to switch off. Sometimes it's difficult, but I think you've got to do it. And if you don't do it, again, it will have an impact on you. Same thing, I think, from a business side as well. I mean, obviously, you've had a hard day, doing sort of meetings and things like that, getting back home, things are lingering, you think, oh, I should have said this, or I should have done that, or, maybe I'll send an email to follow it up and things like that. And initially when I started, I mean, I would lie to say that I wasn't doing that, because I was, and you always sort of have things playing in the back of your mind where you think you've got to be doing, and you almost get consumed by it. You almost think that, oh my God, right, I got to do it, because if I don't do it, it'll be too late by tomorrow. But you've got to realize that sometimes you just got to switch off. You just got to say, right, I've done that bit, and I'll sort of come to it tomorrow. If anything needs to be done, it'll be done tomorrow, unless obviously it's something sort of dire and urgent. So from that perspective, I think over the last, at least recent few years, I'm trying to learn to do that. Obviously, I'm still learning. I wouldn't say I'm perfect at it. Something is difficult when you're running a business and working at the same time. But I'm obviously trying, and it has shown that it does work, and it does give you sort of that mental relaxation that I think you need. And from my side, I get that from my family, and spending a lot of time with my family.
Yeah, I agree. I mean, I've got two fairly young children, primary school age, and I often joke, that they don't care if I'm busy at work, but realistically, why should they? That's not, I don't want their role to be worrying if I'm busy at work and things. They're kids. I want them to be kids, and I want them to have time with dad. And, so yeah, trying to switch off is, really, really important. I now work from home rather than I had an office. So I've had to navigate that. Whereas before, the journey home used to be quite a good time. I could listen to music, listen to a podcast, and I'd, when I said I'd sit in the drive, I wouldn't sit there for it, but turn the key off and they'd be like, right, the day's done, I'm now in. Whereas now it's just simply opening a door from the office into another room. So for me, I'm trying to come up with strategies and just making sure actually when I'm switched off, I am, because you're right, the majority of things can wait to the following day. They really can. And often
you always tell yourself that no, it needs to be done now. But actually, if you step back and look and think, actually, yeah, you can wait a day or two. It's not going to, cause any major significant differences or changes, to be honest. So from that perspective, yeah, I agree.
Yeah, there's certainly, whether it's, a problem you've got to solve or an email you've got to send, actually, sometimes time actually solves that issue. I've quite often had people come to me with a problem, but I've been in a meeting or whatever, and by the time I've got back to them, they've gone, oh, no, don't worry, we've managed to sort it now. And you sort of think, yeah, sometimes actually time is the solver. And, I think as entrepreneurs, we want to fix things, don't we?
Yeah, absolutely. And sometimes you think that, like, if I don't do it, it can't be done. And I think you've got to move away from that frame of mind to actually say, actually, you know what, it can be done. Somebody else would do it.
Yeah.
You don't have to be there. You don't have to do it. And I think, yeah, as you sort of go more into the sort of process, you learn from that and you learn how to do that. And I think that's an important element as well for being an entrepreneur, is you've got to know when not to do things rather than when to do things as well.
Yes, I like that. When to do it. Yeah, rather than sort of how, because it is so important. And I think entrepreneurship is a journey. And I think we've always got to be understand that we're always learning. It doesn't matter, how much you know, how many businesses you've ran. You might get better at business, but actually there's always something new to learn. And I guess you mentioned that about having some key friends, people to actually, sound ideas from. Do you find that's really helped you, having a support system?
It does. I mean, to be honest, being on sort of a startup journey or a business journey where you're setting things up is pretty lonely, because you're on your own. It's your idea, it's your vision, and you're trying to sort of, get things sort of worked around that. And sometimes not many people at an initial stage will see the same vision, they'll see the same idea. Not many people will have the same passion for it, because, at the end of the day, you own the idea, so you're the main driver of it.
Yeah.
So from that perspective, it's always good to have one or two people, even though they don't really know or support the idea fully, they know you, and I think they'll support you.
Yeah.
And sometimes it's always good to have that sort of close network support system. I wouldn't say a wide network, because the problem is too many people you get too many ideas, and that confuses you. And then you don't know where to go from there. So my perspective has always been, have one or two people that you're close to, who've got your back, that, who know what you're like. You can run something past them. They'll come back with something constructive that you can utilize and use. Even if they don't, they may just come back and say, listen, I really don't know how you're going to do that. At least you've spoken about it. And then once you speak about it, it puts things a little bit in perspective as well. So I always find having, a close sort of network of people close to you always helps.
Yeah.
Especially with, not just with work, but even with business, making decisions. Ultimately, the decisions will be yours, but having that little bit of input and help, is always good.
Yeah. Someone cheering you on as such always, is beneficial when you're going through this journey. I've really enjoyed our conversation today. I want to finish just by asking you one simple question of, what does success look like to you?
For me, success, especially in the journey I've started, is ultimate patient satisfaction and patient outcome, top patient outcome. And that's always been my driver, and always tell the people I work with that should be our main driver, because what we set out on the journey is to achieve that. Because if we don't achieve that, that means we've fallen short on, something that we can or could have done to reach that stage. Because in the healthcare sector, there's a lot of different sort of factors and different drivers. And a lot of people get consumed by a financial drive and, how successful a clinic is, how successful a hospital is, and what you're getting. But I think your driver always has to be above that. It has to be, I'm not saying don't make money, because I obviously want to make money, don't get me wrong. But your driver has to be above that. It has to be something that is, more tangible from a perspective of having something you can look back and say, right, I made a difference, not just, for an element or a service, but to a person's life. I've made a difference to people. I've made a difference. And in the healthcare sector, you've got to always have that, because if you cannot make a difference in what you're doing and trying to achieve, that means you're falling short on that. So from my perspective, I think, that is the main driver. And for people who are going to be sort of starting off on this journey, healthcare or anything else, I always sort of tell them that you need to have, there's one word someone told me once, which has stuck with me, is you need to have grit. You need to really have grit, which encompasses, your drive, your passion, encompasses patience. So all of those sort of, incorporate in you delivering or reaching your end result and your sort of end success or outcome, if you like.
Yeah, I completely agree with that. I think the idea of having something above profit is really, really powerful, because actually, quite often as entrepreneurs, as business owners, we're passionate about the profit that comes in, but the whole team that's working, well, that's not their driver, because, you making more money doesn't necessarily motivate them. But what motivates them is that big goal of, making a major difference to someone's life. And that's how, that's got to be a key driver.
Absolutely. Agree with you, spot on.
Thank you so much for joining me today. It's been an absolute pleasure talking to you, and I wish you all the best in your journey and growing your clinics.
Thank you very much, Matt. It's been an absolute pleasure coming on board as well. Thank you very much.
Thank you for tuning in to this episode of the Balanced Ambition podcast. I genuinely hope the stories inspire you as much as they inspire me. If you found value in today's conversation, please share it with a friend. And remember, by subscribing, you won't miss an episode, and it would truly mean the world to me. Stay balanced, and I'll see you next time.